And then when it comes to knees, what are you typically looking at or noticing of your patients?
So typically a knee in an aging athlete is either early arthritis, such as this chart will show us. This is called the Kellgren-Lawrence, KL for short, classification system. One is where you look at a plain X-ray or an MRI, really don't see much in the way of wear and tear. But if you continue through the staging of 2, 3, and 4.
Mhm.
Stage 4 is end stage. You'll see the red areas. This doesn't project real well, but you'll see the wear and tear in the two sides of the joint. What I like to do is try to catch people in stages 2 and 3. And we also still see a fair amount of cartilage lesions that aren't arthritic. They're from an injury such as a meniscus tear. We
Mhm.
do still treat ACL tears. That's not at all uncommon in people in their 50s and older, from
Mhm.
ski injuries, pickleball, tennis, running injuries. So ligament, tendon,
Mhm.
cartilage, both knee and shoulder.
And then you just have to look at how severe the issue is to decide if stem cell and or PRP might be beneficial or if it is really going to require surgery.
That's
Right.
correct. For the vast majority, if you're in stage knee, for example, stage KL4,
Mhm.
you're bone on bone. And in those cases, your best option is generally knee arthroplasty or
Mhm.
replacement. However, there are people that will opt to try stem cell or PRP
Mhm.
because they want to buy time. The
Mhm.
problem with knee and shoulder replacement, especially knee and also hip, those are weight bearing joints every day of your life. If you have that surgery in your 40s or 50s, you have a significant chance that you will need a revision surgery sometime in your lifetime, whether you remain athletically active or not.
Mhm.
And so, if you can buy time with platelet plasma and with cell based stem cell therapy, you're going to save your joint potentially a second or additional operation. So time is important for those
Mhm.
mid-range knee and hip injuries, and to a lesser extent, perhaps also in the shoulder arthritis.
And it also sounds too the importance of actually trying to catch things early when things are maybe beginning to feel injured or having problems versus waiting until it gets to feel like bone on bone or really, really severe. So the earlier you act, the more likely that one of these kinds of treatments will be beneficial.
Absolutely. If you can, I mean, nobody wants to go to the orthopedist every time they have a
Right.
lump, bump, or an ache or a pain.
Right.
But if something is repetitive and every time you impact or you do a certain sport, you pay the price for a period of days for weeks,
Mhm.
what we typically recommend is when you call in, we do a set of plain standing for the hip and knee, and then a series of different views for shoulder x-rays.
Mhm.
And that kind of gives us a baseline. And then we like to see patients in the office, get a good history, do a good physical exam. And then oftentimes we will follow up with an MRI. And then we can stage these lesions, find out if we really have the option of delaying or avoiding surgery. And yes, within reason, the earlier the better.
Yeah.